right. Okay, so first we'll begin with the vitamins. So if you see the things here, what are the things has to be remembered with vitamins? Okay, here we'll be starting the things with vitamins, right. So we are all aware that vitamins are of two types: fat soluble vitamins, water soluble vitamins, right. Fat soluble vitamins, we have vitamin A, vitamin D, vitamin E and vitamin K, and it is important to know the other names of these, or active names of, or active forms of these vitamins. So vitamin A, otherwise known as retinol, it is having three different active forms. Remember, vitamin A, one is aldehyde form, that is retinal, second one is retinol, and third one is retinoic acid. So retinol is the aldehyde form. So this is the form which is mainly useful for vision, whereas retinol is mainly for storage form. Actually, to say, this is acidic form, COOH. So this is for mainly for storage, and retinoic acid is retinol is alcohol form. Retinoic acid is a acid form which is helpful for healthy skin, like epithelium. What is that? Healthy epithelium, right. So three forms are there. Retinal aldehyde form is useful for vision. The rhodopsin, the visual pigment which is present in the eyes, okay, rod cells, rhodopsin, it's combination of what? It is a combination of, first I will be discussing here, remember here, first as we are discussing, retinal, which is aldehyde form, okay, it is present in rod cells, which is containing a pigment what? Rhodopsin. Rhodopsin is a combination of 11 cis retinal plus opsin. So these things you will understand better when you are studying Wahl's visual cycle. If you recollect, when there is a falling of sunlight, UV rays struck the rhodopsin, and that means called as bleaching. So when there is a bleaching of rhodopsin, the 11 cis retinol will be converted to 11 cis retinol alcohol form, and again because of the isomerization, retinol alcohol form will be converted to aldehyde form and eye itself, and maximum amount will be transferred to the liver, where there is another enzyme alcohol dehydrogenase, and then retinol isomerase, which converts trans to cis form, and finally aldehyde form. It will be transported to retina of the eye, and then they will be converted to rhodopsin, right. So this is the thing. So retinal, the storage form is alcohol form, CH2OH. So this is for storage, whereas retinoic acid, which is like gene regulator. So this is, retinoic acid is mainly for, it has got role in growth and development, because it is acts as a gene regulator. It acts on the genes, and also for healthy epithelium. For healthy epithelium we require retinoic acid, okay. 13 cis retinoic acid is required for maintaining the smooth skin and epithelium, right. So this is all about active forms of vitamin A, right. So what are the deficiency disorders? That again we will see, okay. So coming to the vitamin D. Vitamin D, if you are talking about here, vitamin D, cholecalciferol, okay, cholecalciferol, the other name of vitamin D is cholecalciferol. So when you see the activation of vitamin D, otherwise it is known as anti-rachitic vitamin, anti-rachitic vitamin, okay. So we are all aware that there is plenty of cholesterol in our skin, right, that is 7-dehydrocholesterol. So again, when there is a striking of UV rays to our skin, this 7-dehydrocholesterol will be converted to cholecalciferol, and this cholecalciferol shifted to liver, where there is a presence of enzyme 25 hydroxylase and 1 alpha 25 hydroxylase, and this 25 hydroxylase useful in hydroxylation of 25th carbon, and again it is known as calcidiol. Okay,